Hello everyone, and welcome to our webinar entitled The Stress Response, Women's Health, and the Role of the Adaptogens. Our guest speaker today is Dr. Aviva Ram. My name is Michael Chapman, and I'm a medical education specialist at Genova's Asheville branch. I'm going to serve as the moderator for today's webinar. We would like to welcome Dr. Aviva Ram. Dr. Ram is a board-certified family physician, midwife, and herbalist. She's an international authority on botanical and functional medicine for women and children. With 30 years of clinical experience, she is the author of 7 books on natural medicine, including Botanical Medicine for Women's Health, winner of the James A. Duke Award. A graduate of Yale School of Medicine, Dr. Ram is also a member of the advisory board of the Yale Integrative Medicine Program, medical director of the American Herbal Pharmacopoeia, and sits on the expert panel of the American Herbal Products Association's Botanical Safety Handbook. She is an adjunct assistant clinical professor in the Department of Family Medicine at Tufts School of Medicine. And now I'm going to turn the controls over to Dr. Ram, and then we should be getting started.
Hi everybody, this is Aviva Ram, and it is a pleasure to be here today to share with you my insights and clinical pearls, if you will, on what I have come to consider really one of the most foundational core root causes that connect so many of the disparate symptoms and conditions that we're seeing in women's clinical medicine. And that is stress. So I know it's sort of obvious, we all need to relax more, but I really want to share with you what stress actually means. Now, I want to say as a caveat, I am a family doctor. I'm trained in integrative and functional medicine for women, kids, men as well, all ages, shapes and sizes. My focus of my work is women and children's health, and so the talk today is going to focus on data that relates particularly to women. But interestingly, one of the biggest questions I get in response to my blog, my Facebook page, and also from my patients in my clinical practice is, does this stuff work for men too? And the answer is absolutely. We're all we're living in what I call the U.S. of stress, or maybe even more appropriately, the U.S. of distress, as things seem to be unfolding in our society and globally, especially in this past few years. And I really want to take a deep dive into why this topic is so important. And the biggest thing for me is when patients come in to see me and they are struggling with a wide range of chronic symptoms, as I know that you're also seeing if you're in clinical practice or working in any capacity with patients, even if it's around supplement development or anything like that, or testing, we're seeing patients who have symptoms that really touch on every body system. And we have to find ways to make it all make sense. And the story starts for me in the 1990s, in a way, when I first read Sapolsky's book, Why Zebras Don't Get Ulcers. I have a shelf in my office for my most important or my favorite books, and that book has always sat on that shelf because I've considered it so interesting and important, because in medicine we're trained to see everything in silos, right? You have your endocrinologist for your endocrine problems, you have your gastroenterologist for your GI problems, you have your cardiologist for your cardiac problems and your cardiac health, and then you have your primary doctor, or if you're a woman, your gynecologist for part of your primary care, and nobody's connecting the dots. You've got patients on different medications from each of those. Nobody's really connecting the dots on what is going on causing such disparate symptoms. When we start to look at the world of psychoneuroimmunology, which is really the underpinning for this talk, psychoneuroimmunology is a field that says it's all connected. There is no separate immune system, separate endocrine system, separate nervous system. It is all one. And it's fascinating because we know, for example, that our nervous system has receptors for recognition of pattern presentation of white blood cells. We know that our white blood cells respond to neurotransmitters. So we have to really step beyond the silos of medicine and look at the connectivity. also, as clinical practitioners, especially doing integrative or functional medicine, you can't give supplements for every symptom. You can't give supplements for every system, or you'd have a patient who's on 80 supplements a day, which some practitioners do. So how do we start to take a deep dive under the hood, look at what's really going on? And for me, even though, yes, we know that gut health is really important, we know that what's going on with toxins in our environment are a critical impact on our health. When you actually start to look at the impact of those on health, and when you start to look at those actually send out 4 alarm fires to your stress response system. And when your stress response system is in disarray, as we're going to look at in this talk, you end up with dysregulation in every other symptom. So this is a very bidirectional set of circumstances that happen. And what I'm going to look at today is some of that bidirectionality, but specifically the role of how stress, and when I say stress, I'm not talking about stress as a singular entity. I'm talking about things that act as stressors. So a little bit of stress actually isn't a bad thing, and I'm going to talk about that more. But what I'm talking about are things that either make you as an individual feel emotionally stressed out, or impacts that can happen, whether it's an environmental toxin, a food allergen, or food trigger, gut dysbiosis. These also act as stressors. So when we talk about stress, we're talking about the things that make us feel emotionally stressed out, but also that have a physical impact that create inflammation that gets the stress response activated. So let's start talking about women and stress specifically. So 75 to 90% of all physician office visits in the United States are now established to be related to stress-related ailments. And references are at the end of the talk, so I'm not going to cite chapter and verse on this, but you've got all the data there for you. The American Psychological Association reports in its most recent study that 75% of all Americans have moderate to severe stress. Everybody's experiencing some stress. There are very few people that are actually stress-free. So everyone's got some, but this is a pretty substantial amount that have moderate to severe. And 30% are more likely women than men to report experiencing a great deal of stress. Interestingly, and there are a number of different factors that contribute to this, none of which are women are more emotional. So I want to take that off the table right away. Women go through hormonal and life cycle changes that make women actually more physiologically susceptible to stress, impact on the body, and to psychological impact. And there's a lot of different data that looks at this, which it's newer data that's not in this PowerPoint. It's actually just data I've come across, interestingly, in the last few weeks, because I've been working on a book on a thyroid and adrenal impact on women. And just for example, women are more likely than men, if in a couple, heterosexual couple, to internalize their male partner's stressful day at work with a marked and notable measurable elevation in their cortisol than men. So men, when a woman reports her stressful day to her partner at the end of the day, he does not internalize it, his stress response does not get triggered, and his cortisol does not go up. So this is probably due to some evolutionary adaptations in women's connectivity and social relatability that may have to do with attachment functions to protection for offspring and oxytocin release. So it's a positive in that women are very relatable, but it also makes women more susceptible. In addition, life cycle changes in estrogen particularly can make women more vulnerable to the physiologic impact of stress. So, for example, if you're going through a hormonal change, whether that's puberty, pregnancy, postpartum, or perimenopause or menopause, and you're going through a particular stress at that time, that connectivity between estrogen and cortisol actually makes women more predisposed to developing autoimmune conditions. So there's a number of greater physical and emotional symptoms that women have than men. Some of the more common ones are headache, emotionality, and digestive upset. But we also know that women are way more, 10 to 1 more predisposed to something like IBS, or 8 to 1 more predisposed to autoimmune conditions. And another issue is that women have social roles that require us to lean in, do it all, have it all, be it all, that are very programmed into our being, with also a higher level of lack of perceived autonomy and independence. So these are all factors that up the ante for women on stress. So what happens when we have too much stress is that all the coping mechanisms that our bodies are meant to have to adapt to stress and to the stress response become an overburden. And so what happens is, when you go through the stress response, in short, your amygdala perceives a hazard. It's a little bit like your amygdala is getting a 911 call that there's a fire. Somebody sees a fire, they call 911, your amygdala registers that something's going on. Your amygdala acts as a dispatch to the fire station. Let's think about the fire station as your hypothalamus and your pituitary. The fire station gets the message is passed on to the chief and the pituitary. The pituitary then says, all right, we've got to send out the troops, we got to send out the firemen, and we've got to send out the fire trucks, and we got to get some water on this fire. So think about those chemical messengers that are going from your brain to your adrenal glands as the that first dispatch. Then those are the firemen, and then think about the fire trucks sort of as the next stage, and then your cortisol and your adrenaline are like the water going out to put out the fire. And you want to think about it also when a fire alarm is called, it's not just the fire department that gets dispatched, it's the police and the ambulance services as well, because nobody really knows what the emergency is. And your brain is kind of the same way. Your brain just sends out all the reinforcements. So your immune system gets activated, your endocrine system gets shut down to some extent, with the exception of what's going on with your blood sugar regulation and your adrenal hormones. So your body is doing everything it can to protect you and goes into this, what we call commonly, fight or flight mode. And that fight or flight mode does things like accelerate your heart rate, makes you become hypervigilant, so you're aware of everything in your environment, your pupils dilate, you're just much more aware of what's going on. Your brain is rapidly storing all the memories in your amygdala that relate to this hazard, so it can pull up those hazards later as a really early warning system, which is a big part of how PTSD forms, actually. Your body is mobilizing large amounts of blood sugar into your circulatory system to get out to your musculature so you can run away from that danger or fight it. Your pancreas is pumping out insulin so that when the emergency is over, that blood sugar can be taken back up rather than causing rampant damage from chronic inflammation from extra blood sugar in your circulatory system. And energy and blood flow are diverted away from what are called non-essential, or what Sapolsky calls optimistic functions, like digestion, because you can always digest later. You don't need to digest right now in the emergency, and also reproduction, because in an emergency is not a great time to be thinking about baby making, right? And it's only in the movies that baby making music is playing and people are, getting it on in some kind of like high-speed chase. That just doesn't happen in real life. Your body is saying, this is not a safe time. And what happens is you end up with something called pregnenolone, or commonly called cortisol steal, where your body is now diverting production of sex hormones, estrogen, progesterone, and testosterone, into cortisol production and shutting down your reproductive function. So you can end up with a lot of downstream effects that we're going to look at. Also, your body goes into an energy conservation mode because it doesn't know that the hazard isn't, let's say, a food shortage or famine. So your body does everything it can to store extra energy and turn down the thermostat because it may be an energy crisis. And what do we do in an energy crisis? We turn down our thermostat to a lower set point. What's the thermostat in your body? Guess what? It's your thyroid. So when these functions become dysregulated, we end up with the downstream effects of cortisol and adrenaline dysregulation and the impact of that. The impact of that is called allostatic load. So allostasis is the term coined by psychoneuroimmunologists it's sort of a progression, if you will, of homeostasis. Homeostasis is sort of like your body trying to keep your pH within a certain set point, because you need to keep your pH within a certain set point so your cells don't die. Homeostasis is the ability to adapt to the environment. So it's not a set point. It's finding new set points within the need to adapt. When your body is adapting and adapting and adapting and adapting, at some point, actually, the system gets overloaded and you start to end up with these downstream problems. Now, in your clinical practice, there are actually some measures that you can use that have been validated by the MacArthur Study of Successful Aging, which looked at the primary and secondary mediators that you will see if somebody is in allostatic load. Some of these are the primary mediators, not surprisingly, are cortisol. You want to look at overnight cortisol, although we're going to look at some 24-hour salivary cortisols as well. Catecholamines, so your stress hormones or your metabolic products of your catecholamines. So that's an important if those are elevated. Cortisol can either be elevated or low, depending on whether you're in adrenal overdrive, is what I call it, or you've reached a point of exhaustion. And then DHES, which is an adrenally produced hormone, a precursor to your testosterone, and also a mediator of the stress response. And it's a mediator also of ability to use cholesterol rather than storing it as, or fat rather than storing it as cholesterol, your ability to build muscle, many of the things that are impacted when you're in this allostatic load. The secondary mediators that are important are waist to hip ratio. So we know when you have an elevated waist to hip ratio, that is a very, very significant marker, as is waist circumference. So waist circumference for men and women is one of the primary predictors of risk for heart attack and diabetes. So it's an important measure that I actually use in my practice. You can use that, or you can use waist to hip, although waist circumference is actually the gold standard. Your systolic to diastolic blood pressure ratio, if your albumin is low, for those of you who work in hospitals, you know that low albumin, particularly in the elderly, is actually predictive of a bad outcome, particularly in the ICU. Your total cholesterol and HDL, I also look at cholesterol particle sizes and sort of lesser cholesterol parameters and my APOs as well, but it's the total and the HDL that have been validated in the MacArthur study. Hemoglobin, and elevated hemoglobin is a marker of inflammation. Low hemoglobin is a proxy for malnutrition or undernutrition. Fibrinogen and CRP, of course, as markers for inflammation. I don't do these tests on every patient, and I don't do all of these tests on every patient, but getting a basic panel on inflammation, getting a basic waist circumference or waist to hip ratio is something really important for patients. Whether or not they are overweight, the inflammatory markers are important, because you can be a skinny fat person too. You can have inflammatory markers and even be pre-diabetic or insulin resistant, but not be overweight. So it's still important in the waist to hip ratio. Anyone who even looks overweight or has an elevated BMI, I would get that. And it's a really easy thing to remeasure on follow-up visits. And then the cortisol, catecholamines, and the DHES I check as a panel in my patients who are coming in with symptoms of allostatic load or any of the downstream effects that we're going to talk about. So one of the major drivers of the stress response is, or one of the major factors that happens in the stress response is that we're using up a lot of fat, we're burning fat, we're using up sugar, and we're also needing more salt, because if you think about the stress response, what it's trying to do is protect you in all emergencies. So let's say you were being chased by the proverbial saber-toothed tiger and it gored you. One of the protective mechanisms for your body is to elevate your blood pressure to keep you from going into shock. Elevated blood pressure also, to a certain extent, allows for more perfusion of blood to your brain, so supports that hypervigilance, that quick thinking, that quick responsive awareness. So when you're in constant stress mode, which most Americans, as we've established, are, you're actually using up these core nutrients and these core macromolecules. And interestingly, being in chronic stress not only makes you crave fat, sugar, and salt, and when I say sugar, I'm including carbs in there, But it changes your brain's it changes your brain's responsiveness to taste so that it makes those tastes more salient. It makes fat, sugar, and salt not only more desirable, but when you eat them, it makes them taste better. It also changes your crosstalk between what's going on in your abdominal fat, which interestingly, when you're in this chronic stress response, the place that you pack on fat most is in your abdominal area, so your belly fat, so you develop more visceral adipose tissue, which we know is not just flubber. It's a dynamic, active, metabolic organ that is sending messages to your brain. It is sending out inflammatory messages throughout your body and brain, but it's also affecting your leptin and ghrelin crosstalk. And it's really fascinating. So when you're in the stress response, it makes sugar and carbs and salt taste better. It makes you want them more. But it also turns off your sense of satiety and increases your sense of hunger. And so someone who's in this stress response can diet and diet and diet. They can change their diet. They can heal their gut. But it is still going to be driving these messages. The more abdominal fat you pack on, it's also sending out responses to your brain that decrease corticotropin releasing factor and decreases glucocorticoids into the brainstem. And so eating more of those substances and packing on more belly fat actually acts as a self-soothing drug. And so you can end up in this really powerful cycle of hunger, desire, addiction, belly fat, and guess what? Insulin resistance, metabolic syndrome, chronic inflammation, diabetes, heart disease, stroke, all from this overly activated stress response. Also, as I mentioned, your blood pressure gets elevated. These peripheral hormones actually raise angiotensin and aldosterone along with cortisol, and that also keeps your blood pressure potentially chronically elevated. So when we're working with patients who have insulin resistance, and we're working with patients with hypertension, we have to not just give lip service to saying to someone, okay, you got to work on your stress. We have to actually look at this with the same intensity of scrutiny that we're looking at things like gut dysbiosis. We have to really take a deep dive and make sure we're not just saying it to patients, but we're working on it with them at every visit, that we have health coaches, if possible, or nursing staff, or group sessions that can work with patients in between on this. It's so critical. So interestingly, with women in allostatic load, women are much more likely than men to eat as a way to manage stress. Women report having eaten too much or unhealthy foods due to stress than men, but both do, as you can see from the data here. And at least a third of people report lack of willpower as a barrier to their best health choices, and more than half say that for their willpower to improve, they'd have to feel less stress and more energy. Now, here's something really fascinating. Stress affects the functioning of the neurons in the frontal cortex. Stress blunts willpower and decision-making. So again, you can send someone home with the most awesome functional medicine, cardiometabolic diet, or blood sugar solution diet. If you're not getting to the bottom of what is driving them and helping to soothe this system in ways other than food, it's very hard to get under the hood of what's going on. Also, there is a powerful impact on gut health. So as I mentioned, when you're in the stress response, blood flow is diverted away from your gut to your periphery so you can deal with this acute stress. But when it's happening day in and day out because you're running late for work, you're running late for the webinar you really want to get to, or you're having to figure out who's going to, handle that patient who's now running late because you want to get to the webinar, and then you remember that your tax bill is due and it's a little higher than you realize, and you've got to hire someone new for your practice, and your kid's got this going on, that going, it adds up, and most people are living like this all the time. Then you add to it, this next shooting, this next bombing. It's a terrifying world, and so most of us are living with a lot of blood flow getting diverted away from our gut. when that blood flow gets diverted away from your gut, we think a lot about the microbiome, but we have to think about what is happening under the microbiome. If you think about the microbiome as the plants that are growing in the garden, you have to think about the soil. And the soil is the substrate. That is the bioterrain that feeds and nourishes the gut. When you have an unhealthy gut lining, you have an unhealthy bioterrain that's growing on that, and you have a very high predisposition to gut dysbiosis. Additionally, when you have this high level of stress impact going on, it actually creates chemical changes in your gut that change the balance of the microflora. It changes the pH. It changes your intestinal milieu. So you can have statistically significant shifts in the proportions of a variety of species in your gut just from short-term stress. So a high-intensity fighter pilot in combat can have drastic changes in their gut in one flight. A group of pilots that were studied who were just regular flight pilots for 1 week prior to their first real solo flight after training were put into a controlled setting, so they were all eating the same diet, getting the same exposures, and all had a relatively comparable level of stress. I mean, of course, everybody has a different stress coping mechanisms, but relatively comparable level of stress. And in 1 week, there were significant shifts away from lactobacillus and bifidobacterium species toward Clostridium and other more pathogenic species. Now, this is often rectifiable, but it can also, in some people, particularly if they're more susceptible or if they already have predispositions or taken antibiotics, really wipe out important species that are very hard to get back. I mean, we can actually have extinction of species in our gut. Now, other positive flora can sometimes take that space, just like when we deforest a rainforest section, other species can come in, but it's not what the native forest really was. Interestingly, also, this chronic exposure to cortisol and stress impact can decrease your secretory IgA. And of course, as I mentioned, this decreased willpower and increased cravings not only has a direct impact, but it leads to poor food choices and higher levels of sugar and carb intake, which also impact your gut flora. Here is an example of one of the tests that I use in my practice, and we can look at actually measurably gut flora diversity. So in this example, you see decreased butyrate, which feeds healthy microbiome. You see decreased total short-chain fatty acids, which we know happens when you have a shift into gut flora that are not as effective as breaking down long-chain fatty acids into short-chain fatty acids. You also see insufficiency in gut enzymes, important because we're thinking, okay, the pancreas is not just pumping out more insulin, but your pancreas is impacted by stress, so you get a change in the production of your digestive enzymes, your stomach acid, as well as your pancreatic enzymes. So that we can look at these various external markers. Now, some of it you can do without having to do tests because you can just say, well, these are the typical downstream effects. I find sometimes testing is very helpful because it can show the patient objectively what is going on, and it also gives you something very measurable to compare to as things improve. And here we're looking at gut diversity, gut flora diversity, and we know just like in the external world, biodiversity is it's essential for sustainability of health, and there's no difference in what's going on in the external world, in the external environment, and what's going on in our gut. And you can see in this example, you have a patient's results show a low relative abundance of diversity compared to a broader sample. So you want to look at how can you restore diversity, but you also want to look at not just a probiotic, but what medium is that probiotic going to go into? It has to have healthy soil, and to do that, we have to reduce the stress response. So we're going to talk about that. So there are also multiple pathways to increase cardiovascular disease. Now, when the stress response gets activated, you end up with this hypercortisolemia, that central truncal obesity that I mentioned, the insulin resistance I mentioned. You also end up with the potential for hypertension that I mentioned. The visceral abdominal tissue is also increasing systemic inflammatory markers. So your CRP, your IL-6, your tumor necrosis factor, your platelets all get activated in inflammation. Again, this is supposed to be a response that protects us because it maybe happens for a couple of hours at a time, extremely infrequently, not all day, every day for most people. When you have this chronic or repeated exposure to sympathetic stimulation, not only does your heart rate get increased, and we all know that, right? We've had that physical experience of hearing a sound when we're walking in a parking lot, or thinking someone's in our house, or something stressful happening in our life, or getting a stressful phone call. What happens? Your heart rate goes up. You hold your breath for a minute and your heart rate goes up. But when that's happening so often that we're not even aware of a rhythmic heart rate anymore, it can actually start to have an impact on things like your baroreflex function, your myocardial electrical stability. And so things like atrial fibrillation can actually be a result of this chronic exposure to elevated cortisol and elevated catecholamines. You can also end up with decreased left ventricular ejection function, increased risk of cardiovascular events, even over 5 years of a really not even markedly elevated stress response, but just a normal stress response that people are going through day after day. I want to mention, too, that loneliness is a predisposing factor for a chronically elevated stress response. And, sometimes we're the only contact other human beings have as physicians. Sometimes people are coming to us and we are their touch points. I kind of want to remind you that you can actually have an impact on your patient's loneliness by your connectivity with your patient. And you can actually reduce your own stress response by doing that too, because you're stimulating oxytocin release for yourself, which is an antidote to the stress response. But also depression, hopelessness, these all increase the risk of cardiovascular disease more than diabetes, hypertension, smoking, and obesity put together. So when our patients come in, it's not just giving them a probiotic or giving them some betaine HCl or another intervention or another supplement. It's really looking at how can we help them make connections in their community, and how can we even create connectivity within our practices with online Facebook groups, with online chat groups, with groups that are formed within our own practices. So just a food for thought and inspiration there. As I mentioned, when you're in the stress response, energy gets diverted away from reproductive hormone production toward cortisol production. It also is having an impact on your thyroid, and your thyroid plays a major role in reproductive hormone production and functionality and regulation. So here's just a few examples that HPA axis overstimulation or chronic, and let me just say this happens even if the stress response is activated for a few days. So women on this call will probably have had some experience in their life, or if you're married, a partner will have had some experience of travel, for example, and then their next period comes late, a high stress time in your life, a move or something, and then you have an irregular cycle the next cycle or two. So you can see it from even a short-term impact, but long-term impact is significant. And what we're seeing is 1 in 8 women at least are going in for an infertility consult. We have a 34% cesarean section rate. Now, granted, there's a lot of politics and obstetrics, financial incentive behind that, but we do have a lot of women who are not going into labor spontaneously, and we know that stress has an impact on the hormones that stimulate labor. We know that we see a lot of women with breast milk production problems. We see a lot of women with thyroid problems that are impacting fertility, reproduction, higher rates of miscarriage. So these are just some of the examples. What HPA axis chronic activation does is a number of things. It inhibits gonadotropin release hormone secretion. It impacts prolactin secretion. You can end up with problems like premature ovarian failure, anovulation, corpus luteal dysfunction, ovarian function, all of which can lead to problems like infertility. But premature ovarian failure is actually also a risk factor for osteoporosis and heart disease due to the markedly decreased estrogen production. So super important. And think about this in 2 ways. Think about it when you have patients who are coming in with these problems, to make sure that you're testing for the parameters that I mentioned, at least some of those the primary markers in the MacArthur study, or if they're coming in, and when they are coming in with these clinical conditions, to make sure you're looking at the stress response. You're not just saying, oh, here's a patient coming in with fertility problems, let me give them some hormone support, detoxification support, and some Vitex, some chasteberry. Let's really make sure we're getting under the hood, not just going natural, but going with the root causes of the problem. So, as I mentioned earlier, hypervigilance is one of the normal reactivities of the stress response. We are supposed to become aware. When we are chronically hypervigilant, that is code word for anxiety. Chronic hypervigilance is the same as anxiety. Every symptom of the stress response and every symptom of hypervigilance is the same symptoms of anxiety. So we have a lot of patients who are coming in for anxiety. I don't know about you, but I see so many patients, probably 1 in 4, coming in from another doctor who is on an anti-anxiety medication, often a benzo, which are addictive, which can cause long-term cognitive problems that are sometimes irreversible, and build tolerance. So not only are they addictive, but you have to take more and more of them, and they're kind of given out like candy. We have to look at what's going on in the stress response and not just take a GABA 5-HTP response. Those are very helpful, but we have to take a deeper dive at what's going on with the anxiety. Why is this person hypervigilant? What is going on that's creating chronic activation of their stress response system? Also, cortisol can cause a number of emotional responses. Anyone who has seen a patient who has been given a steroid or has a family member who has taken a steroid themselves knows that it can not only cause activation and aggravation of your anxiety, but it can cause depression, it can cause mania, it can cause sleep problems. And we know that cortisol can cause significant problems with mood, while adrenaline can cause significant problems with anxiety. So whenever we have patients who are under chronic stress, who are experiencing anxiety, depression, sleep problems, we always want to get under the hood of what is going on in their stress response system. Now, chronic stress depletes dopamine. We know that chronic stress and its impact on the gut can also inhibit dopamine, serotonin production. There's a lot going on in the gut with neurotransmitter production. We know that when you're under chronic stress, you are producing, because we've discussed this, a large number of inflammatory cytokines. Those cytokines cross the blood-brain barrier and can be causing chronic brain inflammation. So inflammation in the brain is a major predisposing factor for depression. We also know that when someone's been under the stress response for a really long time, your brain starts to say, all right, there's no fire, but I am sending out the firemen every single day, and this is too costly. So I'm going to turn down this response. And so what can then happen is the response is dampened, and you're not getting the stimulating effects of adrenaline and cortisol, and then you can end up with significant melancholic depression or atypical depression. So the melancholic depression is really more the hyperarousal, but atypical depression is a very lethargic, fatigued, downregulated HPA activation. It's not truly adrenal fatigue. It's not really that the adrenals have stopped producing cortisol. It's that the brain is telling the adrenals to stop sending out the fire department. It's 911 saying, you know what, guys, too many false alarms, too many boys crying, Peter's crying wolf. Is it Peter who cried wolf? Yeah, Peter and the wolf. Let's stop this overproduction. In fact, let's quiet everything down. And so you end up with that down regulation. And again, remember, part of what gets turned down is your internal thyroid thermostat, and that's also associated with depression. At least half of Americans at this point are struggling with sleep problems. 49% of all women in the American Sleep Association say they lay awake, at least in the last month, because of stress. And we know that poor sleep is a major comorbidity for a number of health problems. We know that even just losing an hour of sleep a night for a relatively short period of time, like a week, can cause you to gain weight and cause elevated cortisol. Even one poor night of sleep causes cortisol elevation. And we know that women who work night shifts, for example, night working nurses, have higher rates of diabetes, insulin resistance, anxiety, depression, as well as breast cancer, which is sort of an ultimate, cancer is an ultimate dysregulation of the inflammatory and immune system. So sleep affects everything, and it's also going to affect your food choices because you're tired, so you're going to be going for the sugar. You know, it's going to add to the double whammy of willpower by blunting self-regulation. It affects cognitive function. So getting to the bottom of what is dysregulating a woman's sleep, which is often hypervigilance or tired and wired, is critical for getting chronic health problems under better control, helping someone have just better flow in their life. So one of the tests I also use in my practice, and I use the Genova, is the adrenal cortex stress profile. And, one thing to keep in mind is it's really a snapshot of a 24-hour period. It's not indicative of what this person's stress response is all the time, but it's an important snapshot. So, you can't just hang your hat on one test, but it's a really good overall indicator of what's going on. And just in short, what you should see is a cortisol that is higher in the morning. Your cortisol activation response gets triggered in the morning with a crescendo that follows the highlighted pattern here. So it should be elevated, and then through the day, it decrescendos to around midnight where it's the lowest, and then it starts to get elevated again. So when I'm seeing somebody who has a very low cortisol in the morning, their cortisol activation response is not getting triggered, that is someone who is often going to have that very sort of dysthymic, fatigued, low energy picture. Or something is happening that is not allowing them. They're not getting good sleep. They're getting really poor sleep. So poor sleep can actually increase or really flatten out your cortisol. And so, sometimes you have a chicken and an egg situation. Is it the adrenal problem or the adrenal stress response problem? I sometimes shorten it by saying adrenal problem, but really it's that adrenal stress response system, the whole HPA system. Is there a problem there, or is there some external stressor that was causing them to not get good sleep? So you have to come at all of this bidirectionally, looking at the psychosocial picture as well. And sometimes you break the vicious cycle in one place and it resets the whole cycle. And sometimes you just have to pick what your entry point is. Is the entry point doing things like more meditation? Is the entry point a supplement? Is the entry point changing an external factor like a job that is killing them, or a marriage or relationships that's not good, or more immutable things like a teenager that's going through a lot of stress, an elderly parent to take care of? Whatever it is, how can you help your patient to come up with stress coping skills or find the right people that can help them with that? Here's another example. This person has essentially got a flipped adrenal stress response. They're high at night, so they're probably not sleeping at night at all, and they're probably intensely exhausted in the morning. Chances are they're living on coffee and sugar just to keep going, and they could be feeling really, really depressed or really anxious. Another very important piece to look at is blood sugar. I have seen people, and particularly women, who are eating clean. I'm saying that with air quotes here. And what I'm saying is they're really restrictive, or they have severe hypoglycemia or recurrent periods of hypoglycemia. And what you often see is a dip during the hypoglycemic period, but a couple of hours later, a big peak. So I have had patients with night eating syndrome, for example, who have a really big peak like this when they should be low. Their cortisol should be close to the baseline here, but it's really high, and something's going on that's keeping that cortisol elevated. So this is a pattern you have to really do a deep dive to shift, and we'll talk about how to do that. This is a person who's, dysregulated, but their pattern is at least a little bit closer to a normal pattern, so hopefully a little bit easier to get a handle on. And this is a little bit of a flattened pattern, but as you can see, is the closest to normal. So this person may have some chronic stress. They're not mounting a great response in the morning, but it's still relatively closer to normal. So a couple more things before we jump into solutions, which I know we need to jump into pretty quickly. This can have a tremendous impact on memory and cognitive function. As I mentioned earlier, it blunts your frontal cortex function. It blunts your willpower and your executive function. It's not just some sort of psycho-emotional thing that's happening. What is happening is you are actually getting atrophy and rewiring of your neurons. Your dendrites are changing, and so you can actually end up with physiologic repatterning that can be changed. I mean, the beauty of our brains is that there is so much neuroplasticity, but this can have an impact on cognitive function. So all the women that are coming in, and men too, saying they have brain fog, that is another code word for adrenal dysfunction. Something's going on in this HPA axis that needs attention. And it is predictive. Chronically being stressed out and anxious is predictive of potential higher risk for dementia. So this is not something to be taken lightly, and definitely something to be addressed. And I mentioned earlier that when you end up in this HPA activation, your body doesn't really know what the alarm is. So it sends out the police department, the fire department, and the ambulance service. So think about your immune system is going into response as the ambulance service. It's there to make sure there's no medical emergency, that you're not going to become overloaded with infection should you get injured in this fight or flight or attacked or gored or whatever might happen. But when you have repeated exposure to chronic stress, your immune system actually also becomes dysregulated. So in addition to the chronic inflammation that I mentioned, when your brain perceives that you're chronically stimulating your immune system, much like it can ultimately tamp down your adrenal response, it can also suppress cellular immunity. So you can end up with dysregulated apoptosis and cells that are reproducing rampantly, which means cancer potentially. You can end up with autoimmune disease because of the dysregulation, not to mention also the dysregulation that's happening in your gut leading to leaky gut, which can also contribute to recurrent endotoxemia. So what I want to talk about now is what we can do. Just one quick slide. This slide on inflammaging, this is actually a real term in the medical literature, and it basically just says that stress, or all the things that act as stressors, whether those are external environment in terms of life stressors, or chronic exposure to environmental toxins, gut dysregulation, any of these things actually upregulate inflammatory mediators enough that they can act as a second hit. So in the second hit hypothesis, it can increase your vulnerability to Alzheimer's, diabetes, etc. It can actually act as the tripwire for an epigenetic response that can send you, especially if you're genetically predisposed, into a disease process. And I mentioned the thyroid impact. You actually get a downregulation of T3 and an increased production of RT3. So how do we break the cycle? So I've mentioned a few things already. One is this idea that I've mentioned sort of just at the beginning, that stress isn't all bad. So if you look at this picture on the slide, this is called the Yerkes-Dodson curve. And what it shows you actually is that too low stress in your life is ennui, it's boredom, it's lack of stimulation. It also translates to lack of immune stimulation. It's being understimulated. That is not an optimal performance place for you in your life. It's also not an optimal performance place for you immunologically. At the same token, the other end of the extreme, too much stress, chronic stress, or feeling stressed out or being overburdened by your environment can lead to anxiety, disorganization, overwhelm, and ultimately all these problems I mentioned. So one of the things to think about is reframing the concept of stress for your patients, because we know that when you perceive stress as bad, again, air quotes, and check out the work of Kelly McGonigal. Kelly McGonigal has done a great amount of work on the upside of stress, which is the name of one of her books, or just watch her TED Talks. But she talks about the positive benefits of stress, or the concept of hormesis, which is what I call it. And hormesis is the scientific term which basically says what doesn't kill you makes you stronger. So a little tiny bit of an exposure to something, it's like a homeopathic dose of something, can actually increase benefits. But it's when it crosses over into too much stress. And I think we all know when that is for us. And that's where you start to introduce the concept to your patients of personal self-awareness. When they know that they're overloaded, what are the symptoms that are in their body that are saying they're overloaded? Well, those are probably the symptoms that brought them into your clinical practice in the first place. And then help them to understand the concepts of self-efficacy and resilience, that they actually can change this. I was interviewing someone recently whose partner is an emergency response person. He's a disaster response person. And in that philosophy, for example, let's say you're in an avalanche. You can't change the fact that the avalanche happened. The avalanche wasn't your fault. So you don't sit there thinking, why me? Why did the avalanche happen? Why am I here? What's wrong with me? Why do I have such bad luck? No, that doesn't change the fact that the avalanche happened and wasn't even your fault. What you do is say, okay, the avalanche happened or it's happening. What can I take responsibility for and change? That's self-efficacy. Tend and befriend is a really important concept. It's something that Shelley Taylor introduced. And it's basically the idea that when we reach out to other people, whether by phone, Facebook, email, however, getting together with people, it not only releases oxytocin, that is an antidote to the stress response for us, but it actually does the same thing in the other person. So you're getting a 2-for-1 by whether you're the person who calls and reaches out to someone or whether you're the recipient of that. But it actually is an important piece in the stress response. And a lot of people are very resistant to saying, I need help. I'm overwhelmed. We live in a culture where we are validated by how much we're doing, how much we're performing, how much we're accomplishing, and how much we're achieving and making. So for ourselves as practitioners, because most of us are a little bit type A, and I'll cop to that too, being able to ask for help and reach out to a friend is a really powerful piece. And these are all things that people can do for free. I talked about blood sugar balance as being really important because your body sees blood sugar imbalances as a trigger. Your body doesn't know whether there's a famine. It's going to store energy. Sleep and sleep support, I mentioned that, and then I mentioned having life coaching available. So let's talk about adaptogens. And what I do when I teach this class is there is so much wonderful science on adaptogens. I don't want you to feel like you're being cut short because I'm not going through every one of these slides. I don't go through every one of these slides unless I'm doing an 8-hour talk, which I do those also on stress response and adaptogens. What I do is include really great examples of the best, reliable, whenever possible, RCTs on the adaptogens so you can see not only the wealth of data, and this is really a tip of the iceberg. There are like over 1,200 studies out there, and some better than others, but many are quite good. But what I want you to see is not just the wealth of the studies and the reliability of the studies, but how adaptogens, they're not a miracle substance by any means, but how they are how their different functions cover all of these different dysregulations that happen as a result of the impact on the stress response. I'm going to flip through those. What I want to give you today is a highlight on a few of the top adaptogens and then some guidelines on how to use them. In short, adaptogens are a class of herbs that have been formally studied since the 1940s, initially studied in the then Soviet Union to exact more performance out of workers, athletes, and the military. My goal in using adaptogens with people is not to get more performance out of them, but to help them to regulate their stress response. And they have amphoteric actions. For any of you who have studied chemistry or remember chemistry, the word amphoteric means that a chemical responds differently depending on the environment it's in. So, for example, certain chemicals will respond differently in your system or in a system in a different pH environment. Adaptogens are much the same. Most of them are amphoteric, so they will either upregulate or downregulate the stress response as is appropriate for that individual. So using the right one is important, but it becomes secondary to just getting comfortable with using them and seeing them as trial and error. The definition of them is that they are non-specific, non-toxic, and that they increase attention, endurance, reduce fatigue, regulate the stress response, and disorders related to the neuroendocrine and immune system. So exactly what we're talking about here. And these are a number of the big areas that we've talked about that they have an impact on mood, energy, immunity, overall systems repair. One of the things I didn't mention is that when you're in this chronic stress response, your body is using up a lot of fuel. So if you're using up a lot of fuel, your body is actually getting fuel by breaking down your own tissue to constantly fuel it. So it can be very hard to build up muscle, but it can also be very hard to have effective tissue repair. Also, if your sleep is impacted or your digestion and assimilation of nutrients is impacted, your ability to repair is impacted there as well. They also improve focus and stamina. And here are just some of the modes of action of that amphoteric regulation that I mentioned. Essentially what they're doing is they're regulating your sympathetic system and immunologic on and off switches, and by proxy having an impact on your endocrine system as well, sometimes directly and sometimes indirectly based on their components. They are generally very well tolerated. A few cautions, I would say. If you're working with a patient who has hypertension or has bipolar anxiety, with an emphasis on the manic, but in general, I'm very cautious with patients with bipolar. I'm more cautious, and that is particularly with the adaptogens called rhodiola for the bipolar and eleutherococcus and ginseng, as well as rhodiola for high blood pressure. All this data is in your slides, so it's all here. I'm more cautious on patients with, I do use them for most of my patients with autoimmune disorders, but if they're post-transplant or if they're on immunosuppressive drugs, then I usually don't give something that is altering the activity in the immune system. And then, of course, anyone who's on other medications, you want to be careful. But there are very few overt contraindications. Because they do help to regulate blood sugar, I'm also careful if I have a type 1 diabetic, of course, and then also with type 2 diabetics.